Welcome to Ladies Talking Love, Season 2, Episode 6. Is my vaginal discharge normal? It's Ladies Talking Love, a community of women uncovering more joy and fulfillment in sex as we learn from experts and amazing women like you. Together, let's create a world where women's sexuality is celebrated and understood, beginning with our own. I'm your host, Ariel Finlinson. Let's talk love. I am absolutely positive it's happened more than once that I've looked in my underwear and been like, wow, that is a lot of stuff. And what is it? And why is it there? Is it normal? This seems excessive. I'm so excited today to get to talk about vaginal discharge. I feel like it's something that isn't talked about enough, like a lot of other things that we talk about in this podcast. But it's so interesting to me how rarely, if ever, I have heard about vaginal discharge. Even before doing this episode, I was like, I honestly don't know a lot about vaginal discharge, and I have a lot of questions. So I hope that this episode helps to answer some of your questions as well. We try to cover what normal discharge is, what it may be like if it's abnormal, or things to look for when to go to the doctor. I hope that it's helpful for you, and also, most importantly, for you to know that your discharge is normal. And it's a part of your body's process to clean and take care of itself. And it's actually so awesome what our bodies can do. In this episode, I get to interview Christine Borden. And a fun fact about Christine is that she actually helped deliver my third baby. So if you're in her area, I would totally recommend looking her up as your midwife. Christine is a certified nurse midwife who practices in Northern California. She earned her master's degree from Columbia University and has been a midwife for 5 years. She has practiced in 3 different states, New York, New Jersey, and California, and a variety of settings, including home and hospital birth. She loves being a midwife because it allows her to be a professional feminist. You can find her on Instagram at Midwifical. Before jumping in, I just wanted to thank you for being here. Thanks for learning with me and exploring these topics that are often taboo to talk about. Thank you so much. If this podcast has been meaningful or helpful for you, I would really appreciate if you could go and leave a review. That helps other people find the podcast and just know what it's all about. So without further ado, let's talk love. I'm so excited to welcome Christine Borden onto Ladies Talking Love. Thanks for joining me, Christine.
Hi, thanks for having me.
I'm so excited to talk about vaginal discharge today because this is a topic that I feel like most of us aren't educated in. And so there's so many things that as a woman, I just didn't know and I still don't know. So I'm excited to learn from you, Christine. Can we just start off by what is vaginal discharge?
Sure. So vaginal discharge is a mixture of things. You've got some skin cells that are coming from the vagina. You've got some mucus, you've got fluid, got little bits of bacteria in it. And that sort of discharge can vary depending on where you are in your life cycle and where you are in your menstrual cycle. And it's something that's normal and happens to everybody who has a vagina, basically.
Why do you think we have such a negative view of this natural process?
That's a loaded question because I think that there's a negative view about women's bodies in general, especially about the vagina. A lot of cultures, religions might see a vagina as something that's dirty or sexual, something that's taboo, can't be talked about. So anything that is related to that or coming from that is also going to be seen in the same light. So I think a lot of people are ashamed of vaginal discharge just because of all of that, cultural, historic, religious, social background to it.
Which is so tricky to then fight it because it is so ingrained in our culture. And I just have to throw this in. When I was talking with Christine before she came on, I was asking her hey, would you be up for talking about vaginal discharge? And she was like, I am happy to talk about anything about vaginas. And I was like, yes. Bring it on.
Yes, exactly.
So I'm so glad. Let's help shift that culture. So you mentioned that during our cycle, our discharge kind of changes throughout our menstrual cycle. Can you kind of walk us through what that looks like? What is the cycle of our discharge through our menstrual cycles?
Sure. So we'll start like day one of your cycle. That's the first day that you have your first full bleed of your period. And most women are going to bleed anywhere from like 3 to 7 days. And then some people might be kind of spotty. So you might have like a brownish discharge or like a light pink discharge towards the end of that. And that's completely normal, unless that's lasting for a while. And then that's something that you might want to explore with your medical care provider.
How long is abnormal for that brown?
I would say that, I mean, typically your period on average 5 to 9 days, but if somebody is going to be spotting for like weeks on end, then I would think that there's something like anatomically or hormonally wrong. So if that's the case, then yes, you should go see someone for that.
Okay.
As you get closer to ovulation, if you're somebody who's ovulating, then that discharge is going to start to turning into more of like a cervical fluid discharge, where it's going to be like a white creamy discharge. Then it gets a little bit more watery, it's smooth, and then right around ovulation we call it the egg white discharge. So this is a discharge that is like really mucousy. If you get it on your underwear or if you have it on your fingers and you kind of stick your fingers together and spread them apart, it's going to look like that egg white consistency where it really, really stretches and it's super clear. That's totally normal. That's exactly what your body needs to get pregnant. People who are taking things like birth pills or other hormonal birth control, they probably won't get that fluid depending on what sort of method they're using. And then as you get into this premenstrual phase, you're going to have another like white creamy discharge again before the period starts again. And all of that would be normal discharge for somebody who's having menstrual cycles. Somebody who hasn't started having periods probably won't have a lot of discharge, and somebody who's stopped having periods probably won't have a lot of discharge unless there's some sort of infectious process going on.
And how many days before ovulation and before your period starts can you kind of expect this more creamy, egg yolky discharge?
Yeah, everybody's different. It depends on the length of your menstrual cycle. So some people might have 2, 3 days of that sort of like creamy discharge, and then like another few days of that transition discharge. And then for egg white discharge, the egg white fluid, that's going to be like a day or 2 days.
Okay.
The discharge that you get prior to the new menstrual cycle can last anywhere from like a week or 2 weeks. It may start like pretty soon after ovulation, or it may take a while to gear up until your next period comes.
That's so interesting. What does the egg white discharge do to help you get pregnant? What's its role?
Yeah, so it's to help sperm transport.
Okay.
So sperm, they swim well, but they need some guidance. So this is a fluid that comes from the cervix itself. It is a fluid that allows for transport really, really well. So the sperm have to, when it's deposited at the cervix, they have to go through the cervical os, the opening of the cervix. They have to go through the length of the cervix. Then they get into the uterus, and then they'll come into the fallopian tubes, which is where the egg is usually hanging out. So this is a fluid that helps protect the sperm because the vagina is an acidic environment and sperm like a basic environment. And then it also helps them swim really, really well.
That is fascinating. I didn't know that. How cool.
Yeah.
That is so awesome. So what we talked a little bit about what normal discharge is like, then what are some things to notice if your discharge isn't normal and maybe you need to go see a doctor or get something checked out?
If you're having symptoms in addition to the discharge, like itchiness, burning, there's an odor, usually with like a infection like BV, bacterial vaginosis, it's going to be a fishy odor. With yeast infections, you'll notice it, we call it a cottage cheesy discharge. So it's a curdy discharge. It's usually profuse. It's white or yellow. Some people will tell me that they notice like a yeasty smell, like yeasted bread or kind of like a beer smell to it, but not everybody notices that. And yeast infections usually come with a lot of like itching, and it doesn't feel like the vagina, like the inside is itching. It feels like the vulva, like the labia and the outer area is itchy. With BV, that discharge may look like your normal discharge, or it may be like a thin grayish or whitish discharge. And that one, I don't see as much itching, but there may be some burning with that. But the odor is usually telltale for BV. And then there's also things that are sexually transmitted. So you might have like a yellow or a green discharge. It might be frothy. Again, there might be an odor. There might be some burning with that. Or it may be like a pus-like discharge is going to be like a yellow-green color and kind of look like thick, like mucus.
And how do you differentiate? Because I think sometimes vaginal discharge for a lot of women, they might be like, it's smelly to me. What is like a normal smell of normal discharge versus some of these other ones you've talked about?
So all vaginas are going to have a smell. It's not supposed to be a bad smell. It's a human smell. To me, as a midwife, I come across a lot of like vaginal discharge and all sorts of fluid, amniotic fluid, menstrual blood. The smell of a vagina is kind of like a musky, earthy smell. And I think that's more pronounced during someone's period, that like musky, earthy smell. If you're sweaty, you may have a little bit of like a body odor smell to that area too. There's lots of folds in that area. You've got the folds with the thighs, the folds with the labia. So you may have just some sweat trapped in that area. That's going to be a normal smell. Vagina should not smell like roses or perfume or lavender. They don't need to smell like these pretty perfumey smells. And that, in fact, is going to make things worse for somebody if they're trying to make the vagina smell that way.
What will happen if you're trying to use products to make your vagina smell better?
Yes.
Better in quotes.
So if you're using something like a douche, if you're using like a feminine wash or like scented wipes or like scented pads or panty liners or for like God forbid tampons, that's the worst. You're destroying the natural pH that the vagina needs to be. The vagina likes an acidic environment, like a 4.0 to 4.5 pH if you're having periods. And when you offset that pH, that allows the bacteria to grow. So then you might be treating this normal odor of the vagina, and then you're going to have BV with this like fishy odor that you're going to hate even more. And then you might have some pain or burning with that as well.
So do all tampons or more so scented tampons?
Scented tampons, but some people might get BV from using tampons.
Yes, we just had an episode on menstrual cups, which I'm a huge fan of trying if you haven't. They're so helpful.
I love menstrual cups.
I love them so much. And how do you, like some of the ones we talked about, obviously it's like, okay, I need to go see a doctor. Are there any of these abnormal discharges that you can kind of take care of yourself?
It depends on how well you know your body. As a midwife, I will say that I often will see people come in because they've tried to treat something and they were like, this was a yeast infection. And I look with a speculum, I'm like, this is textbook BV. So it depends. If you've had a few yeast infections before, you absolutely know this is a yeast infection. Monistat is over the counter. So you could get something like Monistat and use that. If you want something that is like an herbal concoction, some people will do like a probiotic either orally or vaginally. They might use like a garlic clove. They might use yogurt with non-flavored, like active live culture yogurt. And for some people that might work. The people I see are the people who had failed treatments.
Yeah.
So I can't say how often like a home remedy is going to work. But you run into the issue of like, you might be making things worse.
Yeah, no, it's definitely good and never a problem to just go ask and say, hey, what is this going on? I do remember the first time I got a yeast infection and I called my mom and I was like, what is happening? I'm like so itchy. I can't even like stand. Like, I don't know how I'm going to survive. And she's like, I got you. Like, go to the store, get this. But while we're on the topic, can you cover then what is proper care for washing our vulva?
It's super easy. You don't need to do anything special. So let's backtrack a little bit because I think a lot of people will use the word vagina when they actually mean vulva. So vagina is the inside, I call it the inside tube, the place where you would have to put fingers inside of you, the place where you would put like a tampon or a menstrual cup. That is the vagina. The vagina starts at what we call the introitus, which is the entrance of the vagina, and it goes all the way up to the cervix. So that area does not ever need to be cleaned. You do not need to put any sort of soaps or even water. You don't need to put a finger or
Douches. No.
no, please stop. I mean, if you're going to douche, that you're just giving me more business as a midwife. Like I'm
Yeah.
going to see more people with infections and I don't want that. I don't want that sort of visit. The vulva you can clean with warm water. If you're feeling like there's dirt or sweat, you can use a really mild soap, a Dove soap, Cetaphil, CeraVe, things that are non-fragranced, that are sensitive. You don't need any sort of like pH balancing wash in that area. You don't need to like scrub really hard. That's it. That's it, really.
Awesome. Which I feel like no one ever taught me. Like no one talks about like, oh, just use water or, make sure to have no scent. I'm so grateful you're on to teach us because it's so interesting that we just don't learn these basic things.
Yeah.
that are so important.
I should mention, I mean, we haven't really talked about this yet, but like shaving and waxing and like the role of pubic hair. Pubic hair can be something that can help keep a vagina healthy because it helps keep some of those nasty things out. Mm-hmm. So I'm definitely not shaming anybody who wants to remove their pubic hair. You do you, whatever you want to do to make yourself feel like you're sexy, beautiful, womanly, whatever you want to feel. But also don't feel ashamed about having pubic hair because it exists for a reason. So I might actually see more infections with somebody who's constantly waxing or shaving because that's one of the like natural barriers to help protect the vagina.
I didn't know that. That is so cool.
Yeah.
Can you tell us a little bit then, what is vaginal discharge's role with penetrative sex? Like how can vaginal discharge and the time of your cycle affect penetrative sex?
So I think we touched on this a little already, where when you're having sex around ovulation, that's going to really help with getting you pregnant if that's what you want. When you are having sex just for fun, just having fun with sex, and you're aroused, you're going to produce secretions that help lubricate the vagina. And this is a little bit different, where these are coming from specific glands that are creating that moist environment so that there is less friction and so that you can have sex in a pleasurable way. And for some women, if they're dehydrated, they're not going to produce that. If they're breastfeeding, they're not going to produce that same lubrication. Postmenopausal, if they're not properly aroused, they may not produce that. Stress, they may not produce that. So some people need to add a little bit of lubrication in the form of a silicone-based, water-based, or oil-based lube in that situation. That's perfectly okay. I would much rather have somebody add the lube because they need that to protect themselves rather than try to just tough it out, because you're not going to have pleasurable sex that way. And you can also cause micro tears inside the vagina and increase your risk of getting a sexually transmitted infection, or at least just some sort of irritation from that sexual act.
Is it common that people don't create enough secretions to lubricate themselves? Like, would you suggest most people need lube, or is it kind of like 50-50? What are your thoughts from people you've seen?
It's hard to say. I think that I do talk about lube a lot in my visits in the office. I think that there's a shame. There's a feeling of shame that like, oh, I'm not responding to my partner in the right way, or like there's something wrong with me. I like want to have sex with my partner, but my body's not responding to it. There may be something going on in terms of like hormones or like hydration status, or that just may be like what your body needs. So I wouldn't say that there's like an abnormal normal necessarily here. Everybody's going to produce a different amount depending on what's going on with them.
And what about women who are like, is it normal? I have so much lubrication when I have sex that I never need a lube.
I see that sometimes from my teenagers. So there might be a little bit of like an age factor here. Teenagers are like, what do you mean lube? Why would I need lube? So if you're producing too much, that's an easy fix. Like during sex, you can just use a towel and wipe off, or you can when you're using condoms, the condoms are going to soak up a little bit of that lubrication. So that'll help in that regard. But again, you don't need to insert anything to get rid of it. Yeah.
Yeah. And you'll just be super lubricated.
Yeah.
So
enjoy.
Yeah. So what are some ways that women may choose to take care of their discharge if they're like, I don't want it falling in my underwear, which is totally normal. But what are some things you've seen that women may choose to do?
Yeah, some women may choose to wear like a panty liner. I wouldn't recommend to like insert anything. Don't insert a tampon to try to soak up discharge. Don't insert a menstrual cup to try to soak up discharge. Don't insert a sponge to try to soak up discharge. You don't need to put those things inside your body if you're not bleeding. And in fact, that may lead to other issues like irritation from those items. You might develop an infection. You might develop toxic shock syndrome if it's left inside for too long. You definitely don't need to douche. I mean, really, what I'm saying is you don't need to do anything at all. I think some people get disturbed either by the amount or if you've ever noticed that your underwear, especially like your dark colored or black underwear, end up having these brownish orangish stains in them. That's just from the acidic nature of the discharge. So, I mean, maybe you want to replace your underwear if that's bothering you, but it's all normal and natural. There's nothing that you really need to do special for it.
How can we make that shift? We've had such a great conversation, Christine, but what are some things we can start to do to maybe shift this view of discharge, to see it that this is normal, this is fine, we don't have to do anything?
I think education, number one. When I was in college, I was a part of this peer taught class. I went to UC Berkeley for my undergrad degree, and I was part of this class called Female Sexuality, which we just abbreviated to FemSex. It was so awesome because I got to learn about feminism and women's bodies and vaginas. And I mean, maybe that was the spark for being a midwife, but it was so great to learn about that. There is a history of peer education, starting with the 1970s, our bodies, ourselves sort of thing. So I think if you have kids, making sure that you're open to your children about bodies and anatomy and that sort of thing. And as they go through puberty, making sure that they know what's normal and what's not. And if you're an adult, pick up a book like Our Bodies, Ourselves. Make sure that you're educating yourself and reading the right literature. I think it really starts there. The bigger context is changing the way that the society and culture views women and vaginas. That's a much bigger ask. But I think that the more that we as women, or like we as people who have vaginas, educate ourselves and really embrace that, that's going to be a huge impetus to changing that culture.
I totally agree. Thank you so much, Christine. This has been awesome. Can you tell us where we can connect with you on social media, or if people are in the area you practice as a midwife?
Sure. I'm on Instagram. My handle is midwifical, so you can find me there. Right now I'm in Los Gatos. I think probably by the time this airs, I'll be switching over to San Francisco. I'll be working for Sutter Health in San Francisco. So if you are having a baby, you don't want to have babies, you have a vaginal infection, you want to talk about birth control, you want to talk about sex. I love like counseling about like trying to conceive and people having like issues with sex. Come on in. I love talking about vaginas.
Which I'm so glad. Thank you so much for coming on today. It was great to have you.
Of course. Thank you.
You guys, vaginal discharge is pretty cool. I feel like maybe I learned at some point in my life about how the egg yolky white discharge helped sperm transport, but I honestly didn't remember it. And how cool is that? Like, wow. And just to have Christine go over again about washing, to be perfectly honest, I don't think that I had ever known that I was just supposed to use water or only needed to use water in my inner labia until about like a month or two ago. No one ever taught me. And that's not something I thought to ask because I'm a grown woman. I know how to wash my body, right? But it's just so fascinating how many of these things that we weren't taught or we didn't understand or that our parents didn't understand, so they weren't able to teach us. There's so much that we can do to help shift this culture with our knowledge as we're learning things and helping educate our kids. It actually really made my day. This is a little off topic of vaginal discharge, but the other day, my son found my menstrual cup and he was like, "Mom, I found your menstrual cup," because I like left it in the bathroom. And I was like, I love that my 4-year-old knows what a menstrual cup is. Like, I don't know if he quite understands all of the things about it, but he knows the name, which I thought was pretty cool. So we can help shift this for our kids to not make it a weird thing to talk about our discharge. And I guess menstrual cycles are a part of our discharge. So maybe it was more on topic than I thought. But I hope this episode was good. I hope that we can continue the conversation. If questions come up this week, I would love to have Christine help maybe answer some of those on Instagram. Thank you so much for joining me. And as always, thanks for talking love. Thank you to all of you who listen and join me on this journey, and to our Ladies Talking Love team who make the podcast possible. Thanks to our sound wizard, Kimberly Demers, our newsletter guru, Lauren Barton, and our miscellaneous task whiz, Jana Norman. As always, thanks for talking love.